Welcome, everyone. I am so delighted that you have made it possible to be present in this historic webinar. We are here gathered together to have a conversation around reading by faith, skills for combating discrimination and gender-based violence. And we are very grateful to the Pan-Caribbean Partnership, PANCAP, against HIV and AIDS for this conversation. I'm not able to see all who are present, but I know that you are here. There will be a poll that is running throughout our conversation. You will be invited to place your mark against one of these options for the question. Sometimes there may be more than one option, as you can see. And we will pick up back on that conversation inside of our question and answer, which is following the presentations. We are really excited for this opportunity for faith leaders to come together, whether you're ordained, whether you are a lay person, just a regular committed member of your particular congregation, for us to have this type of conversation. You know, COVID is really rough on us. COVID has just turned our world upside down, but COVID also has presented opportunities. There are particular groups that become especially vulnerable within this time. And we've had many conversations. I've been on several webinars addressing the matter of COVID and how we're going to be coping. We are so pleased that the faith community, those of us who acknowledge God, who recognize the spiritual part of our lives and how important that is, we are so pleased that we recognize that we have a role in this conversation. Before we move, just some little logistics in terms of managing this platform. Some of us are now pros. We are so expert on connecting virtually, while others are new to the space. So housekeeping, please keep your mics muted. They will be controlled by the person administering the program, but just letting you be aware. If you have questions or comments or clarification as the presentation progresses, please type and submit these in the question field on your webinar panel. We will address them during the Q&A segment at the end of the presentations. Secondly, we need you to know that the webinar is being recorded. And this will be on the PANCAP website and social media platforms. So if you have friends, you have connections, you have other associates, colleagues who will be missing this, you can always let them know that they can access this afterwards on the website. And for you yourself, even if you have to pop off and can't be on here for the rest of the time. You will receive a post-webinar evaluation. Please complete this and provide us with your feedback. This is important as we continually strive to improve your webinar experience and will help us as faith leaders, will help us as a faith leaders coalition, which is what we really want to be presenting to shape the relevant content for follow-up sessions. So we are going to be just moving straight into our webinar. We will be having two present. Well, first of all, I'm so sorry I didn't introduce myself. I'm Patricia Donald Phillips. I have been serving Jesus Christ within the community of the Anglican faith for all of my life. And I was an Anglican deaconess. I now serve in the broader context of development as a social and behavior change development consultant with a focus on gender. So I am just so delighted and privileged to be able to serve in this space. We therefore are going to have two speakers, the Reverend Dr. Marjorie Lewis and boy, Gareth, your title is plentiful, you know. So we will come to you later. Canon Gareth will be our second presenter. So just to share a little bit about Marjorie, who has been a long friend of mine. Marjorie Lewis is the Reverend Dr. Marjorie Lewis. She's chaplain and dean of the Manning Memorial Chapel at Acadia University in Wolfville, Nova Scotia. She is a practical theologian and hails from the United Church in Jamaica and the Cayman Islands. Her academic training has taken place in the Caribbean, Canada, and the UK. A clergywoman, counselor, researcher, educator, and administrator, With 4 decades of experience in ministry, Marjorie is experienced in pastoral counseling, spiritual care, spiritual direction, and the supervision of counselors in Christian and multi-faith contexts. Marjorie has provided counseling and spiritual direction for individuals and groups, developed training programs for pastoral counselors, as well as conducted interventions to meet emerging needs in the Caribbean and now in Canada. Prior to her current post, she served as a chaplain to hospitals in Nova Scotia. She has also worked in the area of theological education and ministerial formation as a lecturer, and we are delighted and we are very proud that Marjorie was the first woman to serve as president of the United Theological College of the West Indies, where I was privileged to be trained. As a lifelong pastoral counselor and spiritual caregiver, she aims at applying academic knowledge to fostering the well-being of individuals, families, and vulnerable groups in the society. Marjorie's training experience in academic work demonstrates cultural competence in providing spiritual care informed by considerations of gender, social class, sexual orientation, and ethnicity. She has published articles in peer-reviewed journals and collaborated with others to edit and co-author publications. She currently participates in professional organizations and groups, such as the Canadian Association for Spiritual Care, CASC, the World Council of Churches, the Reference Group on Human Sexuality, the WCC's Pan-African Women's Ecumenical Empowerment Network, the Jamaica Council for Interfaith Fellowship, the Jamaica Women's Political Caucus, and the Caribbean Women Theologians for Transformation. Boy, Marjorie, you are more than able to guide us in this conversation. And just before you begin to share, I should identify for us some objectives that we have given ourselves for this conversation, and we encapsulate them in three areas. We want to, in this process of reflection for action, to build awareness and provide information. Firstly, on the history of the faith community's response in the region to this fight against discrimination and gender-based violence. Secondly, to explore issues relevant to prevention and the faith community. And thirdly, and this I think is really important, is to seek partners as we forge the path forward. Marjorie, please help us to start this conversation.
Okay, thank you. I'm trying to do my screen sharing, but it's not doing what it's supposed to do. All right, let's try again. All right, Shanti.
I can see your screen, Marjorie. You just need to open the presentation.
Oh, okay.
Screen, yes.
Okay. Thank you.
You know, COVID makes us have to learn all sorts of new things. So
no, it's funny. When we did the run through, I got it. But what I've done is to enlarge my screen, and I can't get it down. So please bear with me here. Shanti, can you reduce my screen?
No, I can't have the screen, Marjorie.
You have to punch. And this is a wonderful lesson in patience, which is a critical Christian virtue and a spiritual virtue for those who have of other things.
Are you seeing it now?
We are seeing a part of your screen. Definitely, I'm seeing that.
Okay, are you seeing leading by faith and something looking like a sun?
No, we're seeing your entire folder. We're seeing the document, and we're seeing your cursor poised on it to open it.
Okay.
It's now a tiny. You see one tiny slide.
Okay.
We're getting there. Getting there.
Okay. What's happening is I'm getting a message saying screen sharing is now paused and a flashing screen.
Okay, so that suggests that we need our back end person support. Again, we just invite those who are listening to be patient with us as this COVID time make us have to just learn.
Pat,
Yes?
Marjorie, you send me your presentation. I will share your presentation.
Wonderful. Wonderful. We just want to acknowledge Shanti from the PANCAP, who is our support.
I wonder if Garth would like to go instead while we wait on Marjorie's presentation.
Garth, you are muted.
Pat would have to introduce me, but I'm ready. And yes, Shanti, you can upload my presentation. Depending.
Yours is up, Garth.
All right, well, let's wheel and come again. Participants, just allow us a moment to introduce to you this gentleman who is going to now be going before. So hang on while I just get my screen up to get to his presentation. One moment. So thank you, Garth, for being ready to go. Small gap. The Reverend Canon Garth Minot is a lecturer of the United Theological College of the West Indies, that's Mona St. Andrew, Jamaica, UTCWI, a role he has held since July the 1st, 2003. In this role, Garth lectures in Introduction to Ministry, Christian Ethics, Introduction to Psychology, and Introduction to Theology, Pastoral Counseling, and Christian Worship. Prior to his current position, Canon Minot was rector of the Brownstown Cure, having been ordained a deacon in 1992 and a priest in 1993. He's a recent graduate of the University of the West Indies with an MPhil degree focusing on the church, social justice, and HIV and AIDS. He's also a graduate of McGill University with an MA in theology and is happily married, and I know so them happily married because I know these people for a while now, to Denise, and they have 2 children. Canon Minot is deputy president of the college and coordinator of the Doctor of Ministry program. He pursued professional development training in areas such as instructional design, basic research skills, and clinical supervision. Other areas of professional involvement include consultant on mainstreaming HIV and AIDS in curriculum, voluntary counseling and testing, HIV and AIDS master trainer, former member of the Ethics Committee of the University of the West Indies Medical Faculty and National Bioethics Committee. Boy, God, them words here are long and plentiful. It shows the amazing, incredible experience that you have bringing to this experience today. He has published articles in the Journal of Caribbean History, Groundings, and the Journal for the Network of African Theological Institutions. He received the CIBC RBC Bank Unsung Hero Award for work in the area of HIV and AIDS. I'm so sorry, I have some background noise. Presently, he's chair of the board of the Jamaica AIDS Support for Life, a non-profit organization serving the needs of people living with HIV, as well as trans persons and other vulnerable groups. I have had the pleasure of serving with Garth in part of this HIV response, where the church and other faith groups have been involved. Garth, it is our pleasure to have you guide us in this conversation.
Thank you so much, Pat, and thank you to everyone joining us in virtual space. Yesterday in our session, Marjorie pointed out how weird it feels to be talking in an empty space while at the same time being conscious of the multiple eyes looking elsewhere from virtual space. So it's a delight, but it feels lonely to be by myself in this space. Nevertheless, grateful for this. Thank you so much. So we have reversed the presentation. Marjorie was going first to give you a background to where we have been in terms of the faith community in the Caribbean, responding to stigma, discrimination, social justice issues, gender issues generally, gender-based violence, etc. And then I'm to pick up from some more intense work that we've been doing in response to HIV. Certainly since 2004, with a patron like Lewin Williams, but much later, certainly from about 2015 thereabouts. So much of what I'm about to say is picking up from about 2015, and Marjorie will take us back to the beginning, so to speak.
Well, that's a good spiritual way. You bring in the start from the present, go to the past.
Thank you so much. Yes, thank you. So the title of my presentation, Promoting Healthy Lifestyle Practices for Jamaicans, the response of the religious sector to reducing non-communicable diseases and HIV and AIDS, and the objectives for the presentation. If you go back to the next slide, Shanti, thank you. Reduction in chronic non-communicable diseases and other lifestyle diseases and disorders. Reduction in stigma discrimination against persons living with HIV in selected church communities representing rural, urban, and inner city communities where graduates of theological education institutions are placed, and improve capacity of selected church communities and religious communities to conduct effective awareness, education, and prevention sessions in their communities. So broadly speaking, that is the nature of our work here in Jamaica. That's the shopping list. I won't go through them because essentially that's my presentation. All of those things on your screen represent the work we're doing in Jamaica, and by extension in partnership with PANCAP and other institutions to lead the religious response to HIV and AIDS. Thank you. We have been working with various partners to further our work, and the Christian education work that we did in Jamaica, based at the United Theological College of the West Indies, enabled us to develop Sunday school material to mainstream HIV and AIDS, gender-based violence, stigma discrimination in Sunday school curricula. And we had some generous donors from the United Kingdom that facilitated that process. And that was like back in 2013, 2014. Next slide. Thank you. Now, I mentioned Dr. Lewin Williams, former president of the United Theological College of the West Indies. He was instrumental in introducing voluntary counseling and testing training at the United Theological College of the West Indies. He was a distinguished Caribbean scholar, Caribbean theologian, and he was convinced that it wasn't worth doing ministry and theology in the region if at the same time the church, and by extension the seminary, was not responding qualitatively and effectively to social issues, social justice issues, medical issues, including HIV. And so with support from Reverend Dr., she's now Deacon Rachel Vernon, Evie Vernon, now in the UK, we introduced VCT training at the seminary at the United Theological College of the West Indies. And we have been going strong since that time. The goal of the VCT training course is the reduction in the level of stigma and discrimination towards persons affected or infected with HIV and AIDS, and it allows for pastors and leaders of churches to mainstream VCT and HIV information in their sermons, in their counseling, Bible studies, etc. Next slide. Our intervention in this way allows us not just to focus on graduates of the seminary, but it strengthens the outreach to the community, which is what Dr. Williams had in mind. So we have trained a number of professionals across the country in Jamaica. Here on your screen is a picture. We're at the National Police College in Jamaica using here are trainees in the VCT program being trained to use the VCT protocol. We have also trained police officers, soldiers, doctors, nurses, etc. Here is another illustration of training at the United Theological College. That's our former librarian at the college doing condom demonstration with another participant in the VCT training program. And in the background, you can't see it clearly, but in the background of that picture are illustrations and examples of various names that people give to the genitals. And we have to educate our people in terms of how these work. The sensitization and awareness building, we recognize that the church and religious communities play a leading role in education and sensitization broadly across the region, and therefore these can play and do play an important role in building awareness about HIV, AIDS, gender-based violence, and so on. And so we have three objectives that enable us to carry out and carry on these sensitization activities: build awareness of members of religious faith communities, build skills of religious and lay leaders, lay leaders, to address sexual health, and thirdly, to reduce HIV-related stigma and discrimination and gender-based violence using a human rights approach. Next slide. The next slide is an example of a training that we have done, participants of the religious community, along with persons from the key population, and we feel it's important to bring religious leaders and members of key population together in all our training so as to be able to create cross-referencing, mutual learning, etc. So that's just an example of a training where both groups came together. Now, we feel that it's important in our training not just to focus on nuts and bolts issues on the ground, hands-on issues, but also policy. Because it is important that not only are we engaged on the ground, but we are influencing lawmakers, policymakers to change policies and laws to be consistent with the social justice advocacy, etc., that we are doing on the ground. And so with support from the AIDS Healthcare Foundation since 2017, we have established a process for encouraging religious communities to develop policies so as to align those policies with national government policies, global policies, so that there can be a joined up approach to engaging HIV intervention in the religious sector. Next slide. The next slide should be a picture of a policy training workshop that we did. That's it, yes, thank you so much. And then you can move to the next slide, which is capacity development. Because we are of the view that in working with religious leaders, a number of us as religious leaders came up through an informal way of operating. So some of us, for example, wake up one morning and we say we had a vision, we saw Jesus, and Jesus told us to set up a church or set up a religious organization, and we complied with that. We're not seminary trained, some of us barely leave primary school, but nevertheless we are bishops and we're in charge of large religious communities. And we feel that everyone has a role to play, everyone is an influencer, and therefore we feel it is our business to develop the capacity of these religious leaders. So we have set ourselves three objectives in this regard: to strengthen the capacity of existing leadership, build the cadre of qualified church leaders so as to help others in their growth and development, and improve the capacity of religious communities to conduct effective HIV training. With this is emphasis on leadership development, training and policy development, and methodologies for education, training, awareness, and sensitization. Next slide. So, emotional intelligence is an important plank in our capacity building portfolio, because we feel that much of the debates and the conflicts we have is really just a misunderstanding of issues. We look at issues differently from different platforms, and we feel we need to bring to bear at some level of emotional maturity when we are debating and in conflict with each other. So the next slide is a photograph of myself and Reverend Verna Cassels with the instructor on emotional intelligence. We were receiving our certificates for our emotional intelligence training. The next slide is a reference to the SAVE workshop, which is a training approach and model developed by persons living with HIV and persons of they are religious leaders living with HIV, but also members of the LGBTQI community. And they have developed an approach to sensitization referred to as SAVE. SAVE from the root word salvation in the religious community. And it's an acronym. S is for safer sex practices. A, access to treatment and nutrition for HIV. V is voluntary counseling and testing. And E, empowerment or not knowing your status. We have used this approach, and so we have trained some religious leaders, which you'll see in the next slide. We started to target female religious leaders, but we of course plan to target also male religious leaders. We're not discriminating in this approach, but we feel this approach is critical for addressing the full scale of the challenges before us. Next slide. We also feel it's important to enable persons to set boundaries. There are various conflicts within religious communities and between religious communities, key populations. And therefore, we feel part of that is to enable and foster an environment where people learn to set boundaries, establish limitations, be clear in terms of what are the terms and conditions of discussions so that we can have meaningful dialogue. So the next slide is a sample, well, Reverend Nielsen Waite, my colleague, who leads this training in terms of setting boundaries. The next slide points to a publication that we have done from the United Theological College of the West Indies with support from the Lutheran Church in the United States, the Jamaica Praying Handbook. Musa Dubé, and Margie will talk more about her, led this project and this process. She herself published some work in this area. She came to Jamaica some years ago, led a workshop. Out of that, we led a process to develop this handbook, and so it's now available to enable and facilitate religious leaders to mainstream HIV, gender-based violence information, stigma discrimination information in sermons, Bible study, prayer meetings, mission evangelism, and so on in their worship services. So the next slide is an example of work done in a workshop by religious leaders being trained to develop liturgies using the Jamaica Praying Handbook. The next slide, you will see a religious leader in a mock religious ceremony using the Jamaica Praying Handbook as a guide. And the next slide is a presentation of the book to the National Library of Jamaica. Beyond that, we do other kinds of outreach to the community. We have been involved in World AIDS Day for a number of years. The next slide is a flyer, an example of a flyer that we've used. And so we're involved in World AIDS Day activities every year. Health fairs, we use these as a means of churches and religious communities have these health fairs. So we partner with them along with other organizations to deliver sensitization, training, and awareness. The next slide will show you students from a high school involved in one of those health fairs. The next slide is focused on consultations, and PANCAP is very instrumental in this area, and I'd like to big up the former director and now the new director in this, because we were able, through the instrumentality of PANCAP, to have our first consultation between religious leaders and key populations, and we have had consultations subsequent to that, and we plan to have more in the future. So the next slide shows you a picture of one of those consultations where Dr. Green and others were present. So I go to research. The project is focused on research. Dr. Lewis and I did some work in Guyana. This was to assist the program at UTC to improve. So we surveyed our graduates of UTC by way of what are they doing in the field, having been trained in VCT. So the next slide shows you a poster that Dr. Lewis and I presented at the University of the West Indies on their research day, as we presented the findings from that research. So we are into research and development. The next slide is references a mapping exercise. I told you about that already, supported by the World Council of Churches, which set the database for the work that we're presently doing. Subsequent to that mapping exercise, the next slide shows the cover of a booklet that we published, which is the findings from that mapping exercise in 2015. And there are some activities coming out of that mapping exercise and the publication. I referenced it earlier in terms of the work we're doing in Jamaica, including the establishment of a religious group steering committee to drive the work that we do. And the committee is a subgroup of the Jamaica Council of Churches. The next is a photograph of Dr. Althea Bailey, one of our consultants, sharing the results of the mapping exercise with a group of stakeholders. And I'm winding down. The next slide talks about partnerships. I mentioned PANCAP, AIDS Healthcare Foundation, Jamaica Council of Churches, Interfaith Council in Jamaica. Dr. Lewis, you heard Pat mentioning Dr. Lewis as a member of that. The next slide references the Ministry of Health and Wellness in Jamaica. And we, through PANCAP, we work with other ministries and governments across the region. And finally, the way forward. And here I am pleading for your support. So I'm asking you, and Pat will say that at the end, sign up to support the religious sector as we roll out our work across the region. And I just have this slide and another. So the way forward is to support religious leaders to provide a safe pastoral care and supportive environment to their parishioners and the communities served by the religious sector to increase sensitization and awareness for protocols of pastoral care, sensitization and products for protective equipment, especially now in COVID time. Care packages for people. We know nutrition is a challenge. People are losing their jobs and people with HIV are affected. Technical support for teachers and educators to support children, as some instructions will now have to be delivered online or virtual, and assisting the religious community to assist students to obtain tools and equipment, computers, telephones, etc. for virtual learning. Finally, in the way forward, to continue to identify facilities for HIV testing, monitoring, and case management so we can further assist persons living with HIV. Partnerships for treatment and access to medication so we can help to decrease viral loads in terms of HIV. Psychosocial support and spiritual support and direction, especially for people living with HIV and now with COVID. And finally, sensitization and awareness of safe health protocols so as to protect everyone, but especially for people living with HIV and AIDS. Sisters and brothers, this was not a sermon, but thank you so very much for your attention, and I look forward to your questions and comments and interaction. Thank you.
Thank you very much, Canon Garth. That was a whole heap of information, and I hope that our 48 participants, well, 44, are poised with their pen in hand and or you're on your phone typing, because we really need to get a grasp of the enormity of the work that is already occurring within the religious community. That persons who serve God, we are definitely serving God through serving humanity in these areas. For those who are just joining us, we are in the midst of our webinar, Leading by Faith, Skills for Combating Discrimination and Gender-Based Violence. And this is a PANCAP webinar. We are looking at the response of the religious organizations. What have we been doing as a faith community to play our part in reducing discrimination, in addressing gender-based violence? And just in case you were wondering, the discrimination, as you would now realize from God's presentation, has to do with the discrimination around HIV and AIDS. We are also recognizing that discrimination is now showing up even in the COVID experience, where whole communities are being alienated, are experiencing negative responses because of the infection of the virus. So we flipped things a bit because of some technical challenges. Ken and Garth went first, helping us to get a picture of what is occurring now. What have we been doing? What are we doing now? We are going to now reverse, as we had intended, to Dr. Lewis, Reverend Dr. Marjorie Lewis, who is going to be giving us a historical perspective, a look at the themes in relation to this matter of responding to discrimination, of responding to gender-based violence. So Marjorie, you ready for us now?
I am quite ready, and Shanti's going to put up the PowerPoint, so let me know when you can see it.
Definitely seeing it.
Okay. So thanks again for the invitation. Greetings to everyone. I hope that you and your loved ones are safe and that you are experiencing well-being in spite of COVID and all the challenges. I'm going to be focusing on some themes. And I put it a Caribbean experience because this is not a comprehensive census. It's not based on a census. It's based on my experience of being at the United Theological College of the West Indies from the beginning of the work on HIV and my work as part of Caribbean women theologians and generally interested in issues around gender. So it's Leading by Faith, Themes from a Caribbean Experience. Next slide, please. Garth had already introduced us to the United Theological College of the West Indies, and that institution has most of its degrees accredited through the University of the West Indies and has students drawn from all across the Caribbean and Central America, all the language areas, English, French, Spanish, Dutch officially, plus all our local heart languages. So it's an important institution because the graduates are from different churches and are sent back home across the Caribbean and Central America, and the impact therefore is significant. As was mentioned before, the late Reverend Dr. Lewin Williams started this work based on the fact that the Caribbean had the second highest prevalence of HIV infection behind sub-Saharan Africa, and it was seen as important for faith leaders to be trained in the facts about HIV and AIDS, in counseling techniques, and hopefully to foster a commitment to advocate for a world free of stigma and discrimination. The churches in the Caribbean, not only those served by UTC graduates, but churches generally are important because Caribbean people are religious peoples, and not just church, but faith-based organizations. I think most people would have experienced that in times of trouble, people tend to go to a faith leader before they would consider going to a therapist. Part of that has to do with stigma against being mentally ill or mad, and also cost. Last time I was in the Caribbean, 1 hour's psychotherapy on the cheaper end was more than the minimum wage for a week. So this is a serious business in terms of the potential of the church. And to say that the psychologists, particularly through the Ministry of Health and those in Jamaica, which I know better, were very, very supportive of the kinds of activities that Garth spoke about for capacity building of ministers in the area. So a few areas in which the churches have worked and from which themes have come are lectures and publications, some of which were already mentioned. The question of counseling and pastoral care versus activism. There are issues coming from the VCT that was at the college, taught at the college, and is still being taught at the college, and the work of the graduates, and links with the World Council of Churches and the United Nations. So these are some of the areas from which I'll pull the themes. Next slide, please. One of the publications that's of significance, in addition to Jamaica Praying, which was mentioned by Garth, is a publication by Caribbean women theologians, ordained and lay, entitled Writing Her Story, Caribbean Women Encounter the Bible Story, and edited by the Right Reverend Patricia Sheraton Bisnoth of Guyana. In this publication, Caribbean women's voices are heard in interviews and records of pioneering women. Some of them were the first women ordained in their denomination. Bible studies, stories about women activists in different Caribbean countries, poetry, and liturgical material. Some of these pieces of work, some of these papers, explore women's experience in the Bible and include the experiences of gender-based violence. What tends to happen is that these awful stories are not really usually the subject of sermons or Bible studies. So to give you a taste, there is one story entitled The Anguish of Rape and Incest, which is a Bible study on 2 Samuel 13, 1-22. This is where David's daughter Tamar is raped by her half-brother, and her full brother then seeks to extract some vengeance. And the men are all acting and behaving, and her voice, apart from her lament, is muted. Then another one is When Home is a Dangerous Place, based on Judges 11, 29-40, Jephthah's daughter, where Jephthah promised God if he was successful in battle, he would sacrifice the first thing that came to meet him. So he was successful, and the first thing, so-called, that came to meet him was his daughter, his only daughter, and she had to be killed to fulfill his vow. This is the short of the short version, but you can imagine that there is a lot to dig into in this. And then there are other things like taking action to end violence against women and children, which is an article with very, very practical steps that people can take. Here's the good news. This publication is freely available online. So if you go to the website of the World Communion of Reformed Churches, look for the link that says Justice Resources, and just scroll down, you will find the entire text free of cost. And I would encourage persons to explore that text and to make use of the resources for your Bible study and for your own reflection. Okay, next. In addition to the Bible, there are different sources for Christian theology. Churches and individuals decide what is the version of Christianity, the understanding of Christianity that's accepted based on the Bible, but already you can see even the Bible gets contested because different people interpret the Bible in different ways. Then you have tradition, the way it is always done, the way that was handed down from the ancestors in the faith and in that tradition, which in some cases people feel cannot be changed. Then you have reason. Church no longer believes, I think for the most part, that the world is flat. because scientific discoveries have helped us to understand more about what God's creation is all about. And then there is experience. And experience is important because particularly in the Western world, where the gospel came to many people through the colonial lens, the interpretation offered initially was the interpretation of the colonizers. But of course, as time went on and as people looked at their experience in light of the Bible, there were different understandings. And so here are a few issues that I will table with respect to that, and to just note for our discussion debates on gender, sexuality, and theology. There are links between gender-based violence and the question of sexuality and matters around HIV and AIDS. With respect to sexuality, the notion that gender has just two definitions is one that has been contested by people within the LGBTIQ community. Some of those brothers and sisters have looked at the biblical text and come to the conclusion that within the Bible itself, you can see at least three genders. You have male, you have female, and you have the eunuchs. And so some work is being done on looking at the eunuchs, looking at Levitical laws which excluded eunuchs from the assembly, from public worship, and contrasting that to what happens in the Christian Testament, particularly in the Acts of the Apostles, where we see someone like the Ethiopian eunuch who is received into the church and who tradition has it was the person that started the Ethiopian church, the Christian church in Ethiopia. So, of course, not all Christians agree with this, but I would say even in terms of what we call the Old Testament, there are very significant eunuchs. For example, the eunuch who helped Queen Esther. But often those stories are not the stories that are told and interpreted in terms of the fact that these people, these eunuchs, first experienced discrimination and were rejected from coming into the assembly of the people of God. But also, if we look closely at the text, some of them played some very, very important roles within the text of the Bible itself and within the history of Christianity. Another important aspect of the text, the biblical text, is that there are interpretations of the Bible that would prohibit same-sex relationships. And this is something that is very, very, very hotly debated among Christians, that one should just not engage in same-sex relationship. It is against the understanding of God and God's purpose for procreation and for humanity. However, LGBTIQ persons and their allies are saying no, but we didn't ask to be born gay. That's how we were. We were made in the image of God as LGBTIQ persons, and we love God, we honor God, and we want to have loving partnerships and families with people of the same sex. That's a hard sell in the Caribbean, and a number of churches would be opposed and are opposed to any such notion. You will see a picture of Mfo Tutu and her wife, Professor Marceline Van Firth. I hope I have not massacred the names. This is the wife of the daughter of Bishop Desmond Tutu, who in fact resigned from her job as a priest in the Anglican Church in South Africa, because although the South African Constitution at the time allowed for human rights of LGBTIQ persons, the Anglican Church did not permit marriage of gay persons. So the theology of the church the discipline of the church, the position of the church meant that she had to give up her vocation and calling in order to be married to the woman with whom she's married. And so you see in these stories ways in which tradition and church discipline inform theology, the ways in which the Bible informs theology, the ways in which people's experience inform theology, and the way in which reason comes into this, that is, within the debate as to how it is that we are to understand gender, sexuality, and theology from a Christian perspective. And the Christians do not all agree on the conclusions. Next slide. Another kind of issue has to do with, okay, if God calls us to love and to love our neighbor as ourselves, how do we actually live that out as Christians? For a number of persons in the early days, I would say about the 80s, when we just started to get aware of the work of HIV and AIDS, there wasn't much of a link being made with gender-based violence at that time, to the best of my knowledge. Early work in HIV and AIDS tended to be limited to, tended to lack any kind of link with gender-based violence. Certainly, initially, people thought it was mainly homosexuals or very promiscuous people who had who contracted HIV. There were difficulties getting people to understand that they couldn't get it by hugging and touching, and a number of people who were known to be HIV positive experienced violence. One of the theological analogies that I recall from the Baptists, the Caribbean Baptists were among the first to try to grapple publicly with education around HIV and AIDS. And they put out a series of educational material, videos, and books entitled AIDS is Coming to Your Church. And the theological point of departure, which was argued very convincingly by the Reverend Dr. Burchell Taylor, was that the attitude that we should take as Christians towards people who were living with HIV and AIDS is similar to the attitude that Jesus took towards lepers. And he made that analogy because of the stigma, the discrimination, and the rejection that lepers in Jesus's time experienced, which was similar to the experience of rejection and discrimination that many persons living with HIV were experiencing. There was also the matter of charity, and the Roman Catholics in particular developed a number of programs to care for people who were, especially those who were suffering from AIDS, from children who were HIV positive, especially as these people kept getting kicked out of their homes and burnt out of their communities. In terms of pastoral care, in addition to the compassion from the biblical analogy with the leprosy, the understanding of lepers, and the charity work to provide food and shelter and so on for people who were rejected because of their status. There was also a kind of theological approach to the LGBTQ community, that you hate the sin and love the sinner. And that is still an issue that is with us. It complicates matters because gender-based violence is and intimate partner violence is not just a feature of heterosexual relationships, but it can also be present in the LGBTQ community. So you can imagine that if you are somebody who might be gay, might be HIV positive, to just take two variables, there's a lot that's coming at you in terms of rejection from the community, disparagement from the church, and to find support to help you with your relationships, to get the courage to go and get tested when you're not sure if the healthcare folks would reject you. Now put squarely before us issues of what do we really mean by pastoral care, and what kind of activism, if any, should we be involved in support and as allies of people, whatever the gender, whatever the sexual orientation, who are dealing with gender-based violence and who may also be living infected or affected with HIV. These definitions have changed over time. So some of the liberation theologians, for example, Emmanuel Larty, would argue that pastoral care includes helping folks to be empowered and helping folks to have a sense of agency to advocate on their behalf. I have put at the side there, to the left of the screen, you will see a poster called Intimate Conviction. And this was a poster from a 27th conference, Commonwealth Conference, held in Jamaica, with people who were committed to getting rid of the anti-sodomy laws across the Commonwealth. Again, there was difference of opinion among the Christian community, because there is a strong lobby, certainly within Jamaica and other parts of the community and some countries in Africa, to retain the anti-sodomy laws, which in the case of Jamaica would mean folks can go to prison for 10 years. Now, the argument of folks in healthcare is that these laws feed discrimination, feed violence, and are a disincentive for people to go and get tested if they perceive that they may be harmed or subjected to some kind of discrimination and abuse if they approach the health services. I think that is one of the issues for us as clergy. How do we refer people, particularly LGBTQ people and persons who, whatever their orientation, who are experiencing gender-based violence? How do we effectively refer them to therapists, to medical doctors who are in a position to assist? I think the trans persons have a particularly difficult challenge, sorry, with respect to getting support and getting their human rights respected within the church and within the healthcare system and generally within the society. And so, as mentioned before, UTCWI started in 2004 with these programs, started the discussion. We didn't all agree. There was one very important conference that was held to look at pastoral care to the LGBTIQ community. That included people from Jamaica AIDS Support, from the Metropolitan Community Church, from ministers in the community, from the LGBTIQ community itself, and from the UTC community. And the conversation continues. A brief mention of the World Council of Churches, since Garth mentioned some of that. There has been collaboration between UTCWI and the Jamaica Council of Churches, other councils of churches across the Caribbean, and the World Council of Churches to tackle both issues of HIV and AIDS and gender-based violence. One of the things that has emerged in these workshops on HIV and AIDS is the realization that some of the people who are infected or affected by HIV and AIDS are people who were subjected to gender-based violence. And so, as a matter of course now, the World Council of Churches led workshops tend to provide built-in counseling support and anticipate that, particularly when women are present, there is somebody there who would have been a victim or a survivor of sexual violence, somebody who may have contracted HIV because of sexual violence, and that even the discussion, which is meant to build awareness could be a trigger for that trauma, and therefore it is a procedure that I would really recommend to anybody who is going to have these discussions, to remember that it is likely that within your audience are persons or persons related to others who have been victims of sexual violence and who may be struggling with the after effects of the trauma, which in some cases include HIV infection. The World Council of Churches also collaborated with people in the Caribbean, in Jamaica in particular, a few years ago, to look at the anniversary of the Decade of Churches in Solidarity with Women. This happened over 20 years ago, and there were all kinds of wonderful things that were supposed to happen, similar to the Beijing and other related international organizations and observances to try to advance the status of women. There had been some advance. I think it would be interesting to see post-COVID-19 what has happened to that. Certainly where I am in Canada, a discussion has already started that the women are having a more serious impact, negative impact with COVID-19 in terms of job loss and in terms of extra work to try to help the children who are at home to get their schoolwork done. So I look forward to research, empirical research that comes out that will analyze these trends in greater detail. Next slide. You will notice that Pat and I are in black today because today is Thursday, and we are part of and supportive of the campaign by the World Council of Churches for a world without rape and violence. So Thursday is in black, and it's black because black is not used negatively but to symbolize resistance and resilience. So people all over the world have joined in, particularly people from faith-based organizations, to wear black on Thursdays, and if you have it, to wear a button such as the one you see on the right of the screen, to wear a pin to declare that you are part of this global movement resisting the attitudes and practices that permit rape and violence. That you're part of a movement that tries to show respect for women who are resilient in the face of injustice and violence, to encourage others to join. And remember, black means resistance and resilience, and it's beautiful. Next slide. I'll also briefly mention that the World Council of Churches has set up a reference group on human sexuality. There are members in the group from different churches across the world. Ideas contend in this group. I myself am a member of that group. There has been research done on a number of issues related to human sexuality, and the end goal is to develop a comprehensive study resource for the churches that would present this range of opinions, the material that's available, and to encourage the discussion. Next slide. I mentioned here the United Nations, UNFPA in particular, but the United Theological College of the West Indies and churches in the Caribbean have worked with a number of UN agencies. Garth already mentioned UNAIDS. There has been work done with UN Women, and the work that I will mention briefly with UNFPA. One of the interesting things is that the United Nations is now trying to collaborate across agencies to maximize resources, and I think we benefited from those initiatives from that kind of perspective in the Caribbean. The United Nations also has recognized the importance of faith-based organizations and have put in place a number of measures to work more closely with faith-based organizations. Of course, there are pros and cons for working with faith-based organizations, but the recognition is that faith-based organizations reach people everywhere and reach people in places and people of certain demographics that are difficult to reach by other agencies. So interfaith engagement has been taking place. I was able to go to 2 such meetings in 2014, one at UN headquarters looking at sexual and reproductive health, and another Caribbean one in Suriname in October of 2014. Reports were made in both of these conferences from the respective countries and regions. The big surprise for me personally was that there was at that time in 2014 existing legislation that permitted child marriage in some Caribbean countries. I did not know that that existed. These meetings have reports, and those reports can be accessed. So there are a number of issues around sexual and reproductive health. Another focus of the United Nations that they invited us to participate in was issues around adolescent pregnancy and the celebration of the International Day of the Girl Child. Next slide. So this is just a picture of a UN meeting with faith-based leaders. Next slide. So we are approaching the COVID-19 discussion. And this photograph is from a Jamaican newspaper article, which was exploring, had interviews with the Minister in charge of Gender Affairs, the Honorable Olivia Babsy-Grange, and gender activists in the country. The view is that there has been an increase in gender-based violence as a result of COVID-19, but that the scale of the incidents and the level is not yet fully known, because not all cases would have yet been reported. But Minister Grange was already, by April of this year, indicated that they were getting increased calls for help from women who needed to escape abusive situations. Next slide. The World Council of Churches also has put out some information about COVID-19 and gender-based violence. And here is a quote from one of their documents. There has been a spike in reports of violence and calls for help in China, Italy, France, and other countries during the enforced isolation periods. In countries like Colombia, reported cases of femicide tripled. In Cali, Colombia, 10 women died during the initial 7 days of enforced lockdown. We also recognize that enforced isolation can and may affect the mental health of those around us, aggravating behaviors that are not normative. In addition, the well-evidenced link between sexual and gender-based violence and HIV, as well as unplanned pregnancies, has escalated fears that this crisis will result in increased cases of sexually transmitted infections, especially HIV. I have also seen a few stories, the two I can recall, from one from Kenya, one from Jamaica, of underage teenage girls turning up for exams pregnant. You know, those summer exams that that a number of schools will have. So we don't yet know the full extent of this, but it is pretty clear that both teenage pregnancy, gender-based violence, and the link to HIV probably will be spiking along with the COVID-19 infections. Next slide. So I've gone on a little long, I think, but I wanted to just summarize some of the issues that came from this global kind of Gallup. The first is that theological differences are real. And when it comes to gender-based violence, associated issues of women's sexual and reproductive health, the church is split with respect to matters such as abortion, sorry, even with respect to understandings of gender-based violence. There's a split with respect to the LGBTQ community. And as Garth mentioned, not everybody has the same level of training and capacity to deal with the counseling needs of parishioners and people in the community who will, in many cases, first seek the minister to assist. There is the issue of the agency of the marginalized. How do people who are survivors of gender-based violence, the ones who cannot speak, like the men and boys in our context in Jamaica, who might have been victims of rape, but who, because of the cultural taboo against same-sex relationships, may find it even more difficult to find a safe place to talk about their trauma and to get help. How do we support the agency of people who are surviving abusive situations in which their human rights have been violated, so that they can take control of their lives, and that the churches and the other agencies that are helping do not have paternalistic models of help, but help people to manage and take control of their lives. Collaboration with other agencies has been ongoing, and that means collaboration with the UN agencies. It means collaboration with government agencies, collaboration at the community level. What are the areas, the examples of good practice around this collaboration, and how can we strengthen this collaboration? The matter of legislation, I think, is something that keeps coming up. A number of pieces of legislation in recent years, certainly the Jamaican side, have been on the table. We have been unable to get legislation passed around decriminalizing abortion, even in restricted circumstances. There are issues relating to the anti-sodomy laws, as I mentioned earlier, which do affect the ways in which everyone feels able to access counseling support and health care.
Maggie, I'm trying to catch you to take a break, but you're great. You don't take no break, you know. I wanted to alert you that we only have about 7 minutes left.
Yeah, that's true.
Program. So if you can push the last thing, so we can even get in even one response from a participant.
Oh, okay. COVID-19, I think, is here, but also there are lessons from the work on HIV and AIDS that I think can inform the response. Intersectionality is important because people have intersecting identities of being Black, of being male, of being female, of being gay, of being straight, and so on. And there may be others. And guess what, Pat? The next slide is, thank you.
Thank you.
So I hope we can surf all of these issues and surf the challenges and come out joyful at the end.
Thank you so much, Reverend Dr. Marjorie Lewis, all the way over there in Canada, Canon Garth Minot, right here in Jamaica. Thank you so much for leading this conversation on Leading by Faith, Skills for Combating Discrimination and GBV, PANCAP webinar. We have a few minutes left, and Shanti in the back end is telling us that we can maybe squeeze another 5 minutes. So wanting to just jump very quickly to our participants to see if you have any question, any comment, even as we want to ensure that you are part of this conversation. Take a look at the polls that are popping up. We have had 2 already. There's a third on your screen. What is the impact of COVID on GBV? And some of this has been addressed. So let's get your response. So Shanti, just need your help to see how do I have our participants' comments noted.
So far, there is just one question.
Yes.
Question is, why is it important to first target the female religious leaders?
Okay, I'm wondering, Maggie, would you like to take that, or Garth? Just a comment, or maybe from each of you?
Yeah, I think each of us could. You go first, Garth.
Yes, thank you. I think it was stimulated by my presentation with the SAVE workshop.
Yes.
The short answer really is that we got funding from INARELA. INARELA is an organization which is comprised of religious leaders that are HIV positive, living with HIV. And so they gave us a grant, that is the Jamaica Council of Churches, to conduct a workshop with female religious leaders addressing stigma, discrimination, gender-based violence. So as I mentioned in my presentation, it's not discriminatory, it's not meant to be discriminatory, and they have committed to supporting us with workshop for male religious leaders, which we will do. So it is not meant to be narrow in that sense. But of course, the tons of research with respect to the vulnerabilities of women, and the thinking is that women reach women best. And so that's why we launched off in that area. So it's not meant to be discriminatory in that way. Thank you.
Maggie?
Yes. Well, first I need to, the credit isn't on this, but I want to let you know that thank you picture is our own Imani Wilmot from out at Bull Bay in Jamaica. Her family, they're well-known surfers. So this is not my original photo. This is Imani. But I would say in my recollection, the first workshops that were held through the UTC and related agencies were actually dominated by male clergy. There were very few women there, and that's because historically the leadership of the church has been male. So they were contacted. So they were there. However, it's also true that sometimes in those spaces, the women's issues, they're difficult to discuss because of the power dynamic. Often the women are in the minority and they're not the bishops. And some of the cultural things about talking about domestic violence and, those kinds of issues, not all women traditionally have been comfortable raising those in mixed company, especially if there are more men than women. And not all men have been receptive to hearing some of that. So I think it is important to have conversations that happen among men alone, among women alone, and conversations that happen with both. Because the men also sometimes are reluctant to share their vulnerability in front of women. We need to challenge this. I had to explain, I remember to a male colleague that, somebody in their care who has been a survivor of rape might not really want to approach a male minister on that issue. They may feel more comfortable talking to a woman initially about that for a number of reasons. Not always the case, but sometimes that is the case. So that's what I think we need for both singles, both genders separately and together. And of course, one day we'll talk about gender beyond 2.
Thank you very much, Maggie. And we want to thank the person who posed that question for us. I know Shandy's keeping her eye out to see if another will squeeze in even a comment to our conversation, as we have been looking at the skills for combating discrimination and gender-based violence. We see a poster up before us, which reminds us that this response by the religious community has been going on for quite a while. This was a poster generated by an organization of which I'm a part called Women's Media Watch, WMW Jamaica, in collaboration with the World Association for Christian Communications and a Canadian-based development agency. And it reminds us of Micah chapter 6, verse 8, I think it is. What does God require of you? To act justly, to love mercy, to walk humbly with your God. And so we are we are asking you, based on what you're hearing this morning, based on this conversation, are you picking up? Are you picking up skills that we need to acquire? Are you observing? Are you reviewing the skills that you already have, that you may already need in order to make this response? How do you feel about the response we have been making so far? Have we been acting justly in the matter of discrimination that occurs? Both Garth and Marjorie raised several areas in which this discrimination shows up. The HIV, which, you know, some people said, why is HIV still an issue? Yes, it still is. Now we have the COVID, which also provides an opportunity for persons to be discriminating. We also heard Marjorie courageously raise for us that, you know, that anathema subject of diverse sexualities, which is another huge area where discrimination shows up. And that even when we're feeling very holy and we say, boy, we love the sinner, we don't love the sin, we don't realize that that is even a problem in itself, that statement, because of what we are describing something that is somebody's life as sin, missing the mark, which is how some of us were taught that that word means. We see the panorama of responses that the church and other religious organizations have been making: training, publication, social responses, partnerships with civil society, partnerships with international agencies. What are they? How do you see these? Are there really skills that are required, or I mean, this is something we can just do off the cuff? In the poll that has been going on, we noted that 45% of the 43, well, this is now 43, but there are about 44 persons present, it said that gender is a social construction, and the exact same amount of people said gender is exactly the same as sex. So even here we see the need and the opportunity to have conversations about what is gender, what society expects of us as a man, a woman, a transgender person, what is sex, the biology that we were born with, the genitals. There's a need to discuss this. For what is gender-based violence, we saw that 94% agreed that this is violence against a person because of their gender, because of the roles. And again, Magic took us to another level when she identified that another issue is not just about woman and the problems and the pressures of that woman experience, and man and the perceptions and stereotypes, but there are the other genders, which again, some of us don't want to face, right in our midst, right in our heart. She shared with us the experience of the family member of this world famous person, Bishop Tutu, who had to give up her calling, her vocation, because of where her gender identity lay and her orientation. So as we are moving into the closing minutes, I am just reminding us that you will receive a very short survey seeking your feedback on this webinar. And your feedback is really important. It's not just to write a report, folks. We really need the help. PANCAP is seeking your support. Canon Garth, Dr. Lewis, Reverend Marjorie, they want to hear how this has been for you. And so the intention is to make this conversation more relevant, the content to meet where you are, meet you where you are. We also want to just alert you that we want to know, are you willing to be a part of this movement? It's a movement. Are you already a part of this movement? What are you doing? And so I will be asking Garth and Marjorie to give us a closing comment. Each of them had a call, they had a call in their presentation. I heard Garth calling us to be involved. I heard Marjorie calling us to think beyond the boundaries, the borders of our mind. And so they're going to get a chance to give us this final call. I also want to remind us, I didn't say it in the beginning, well, to notify us that this is the first in what we intend to be a series. Are you excited? I am excited. The first in a series of conversations that it's really important for us to have. Yeah, man, this is not church and your religious group, where just one person that talk. We want you in the conversation. Garth?
Yes, I'll go first. Thank you so much. Thank you, Pat. Thanks to PANCAP, Dr. Rosamond Brown. Thanks, Marjorie. Thanks, Shanti, for this leadership. So There are 5 things, I said them already, but I just want to quickly reinforce. We need your support, we need your help, we need your prayers, we need your commitment. We need to expand the testing with respect to HIV. All the indications are now that with COVID, other areas of healthy living are going to go on the back burner. We want to HIV to stay on the front burner. So please help us to expand and advocate for the expansion of testing, monitoring, case management to reach far more people with HIV, partnerships for treatment and access to medication. We need psychosocial support for people with various health challenges, but HIV in particular, spiritual direction. All our religious communities now need to step up the game. And you heard Marjorie talk about mental illness. We have to step up our game now, ensuring the dignity of all persons. And finally, sensitization and awareness to ensure that all protocols are observed in order to ensure the health and wellness of people living with HIV and all persons. Thank you so much.
Thank you, Garth. Maggie?
Thank you very much. COVID-19 is putting us into new waters. So like Imani Wilmot from Jamaica, from St. Thomas, we're going to have to surf this, right? The waves are going to come. COVID-19 already is here with us. Some of the therapists are saying the effect of COVID-19 is like multiple grief and trauma, complex grief and trauma, because so much of what was there before no longer exists. So many of the things we're accustomed to, including church. So I was taping a program before I came on, preaching to an empty building. Okay, so we have to keep moving. We have to keep moving, and I want to make an appeal for everybody to do what they can do. Everybody can't do everything, but everybody can do something. And one thing can be to be kind. One thing can be to refuse to be silent when people are being discriminatory. Okay? We need to stop it and to stop the violence, and both men and women. No curative rape. I'm afraid to tell you, no lesbian is going to get cured by a rape, and that continues. And we need to find spaces to have these conversations, and also to be able to build a place where everybody can live and thrive, and to have that emotional intelligence that Garth mentioned, that everybody is not going to sign up with everything that we believe in, but everybody was made in the image of God, and they have a right to live. And if you're a Christian, we are supposed to love, regardless of whether we like or we approve or we disapprove. We are to love and to seek the best for the well-being of the other person. Thanks again to PANCAP, to those of you who came, to Garth and to Pat. This has been really wonderful, and I hope we continue to think and to act to make this world a better place.
Absolutely fantastic. Thank you, Garth and Marjorie, Shanti in the background, PANCAP with all the infrastructure to make this occur. But most importantly, thanks to the 41 persons who survived the conversation, and only 7 left us. What does God require of you? To act justly, to love mercy, to walk humbly with your God. Let's do this. We are powerful. We can. Thank you so much.
Thank you.
And for those who are still listening, before they cut us off, remember those wonderful resources that were identified by both Maggie and Garth. That material is out there. We can continue to equip ourselves. You don't have to wait for the webinars.